Dr. Shahin Ghadir is one of America's top fertility doctors.
And one of Hollywood's leading infertility experts is in Australia to share his expertise.
Also joining us today is Molly's doctor from the Southern California Reproductive Center, Dr. Shahin Ghadir. Welcome.
Thank you. Thank you so much.
I have Dr. Ghadir in the house. He's going to give me some information on how to freeze my embryos.
A little bit of this and that, a little bit of this and that.
Okay.
So surrogacy is the one fastest growing area in the world of fertility. It's becoming much more acceptable. We have people coming from around the entire country offering to be surrogates. We found amazing women that are helping to do this. Yo recomiendo algo a todos mis pacientes. Si estás 99.99 seguro que vas a tener un bebé con alguien, necesitas congelar solamente el huevo. I think it's incredibly smart that you're here. Any woman over the age of 30 who's not about to have a child should always be considering their future. And if they want to have children, and if they are, then what are they going to do? We have had people in our office come back 14 years later.
What?
And 14 years later, 14 years of a frozen embryo was our record in our office.
That I get mixed reviews that say that marijuana does affect fertility, but like what is, I mean, as a doctor, but then as my friend, what are your answers?
You stop the IVF.
Yeah.
And then, lo and behold, you get pregnant.
Baby.
There are still some people that we are not sure why, but the actual process of IVF, whether it's the hormones, whether it's the lighting up of the uterus and the ovaries, it kind of wakes things up. And as they are not successful maybe at that moment, during the next couple of months, their body releases that magical egg that allows them to implant.
I think I applaud him the most so much for being so honest with me and saying, listen, if this is what you want, I'm gonna try to help you make it happen.
So is this hard for little people? Have you done it on little people?
We have done it on little people before, okay? They've done very well. For the reason that you guys are doing it, first, because you haven't been able to get pregnant in close to a year, and second, because you'd like to do genetic testing to make sure that we don't have an outcome like you did in the past, it's recommended.
So the timeline?
There's a very good chance that 4 months from now, my dear, that you will be pregnant with a healthy pregnancy.
Awesome.
Grade good. Doesn't get better than that. It was a day 5 embryo, a perfect looking embryo. It looks gorgeous.
Okay, wonderful.
Okay.
Where are you in the process?
Well, luckily, on August 23rd, which was Shervin's birthday, we had a transfer and it was successful and I'm pregnant.
Wow. Yes! Great!
I don't look at it as making a designer baby. I'm looking at this as a ground stepping point for our country to be able to use data from other places to open doors for research opportunities.
What Dr. Shahin Ghadir is seeing in his LA fertility clinic is now backed up by research. An analysis of almost 200 studies looking at more than 40,000 men.